My name is Nara Murillo. I'm the host of Agewell Avenue podcast, and my co-host is Barbara Slingloff.
On this show, we talk about navigating healthcare, housing, investing, and advocating for our seniors.
So on our last podcast, I think I talked about my, being laid off from my job, and just wanted to keep you up to date of what I'm doing now and where I'm at and where I'm working. So I work as a inpatient review nurse at a senior healthcare, which is its alignment healthcare, and they only service the senior community, which is great for me because that's where that's my passion, and that's where I'd love to be and help this population. And the more I can be involved and do for them, the better I feel, and I just love that. So I'm just going to kind of tell you a little bit about what I'm doing there. As far as the inpatient review nurse entails, is I manage mostly Southern California. So it's all of the hospitals in Southern California. I used to manage Northern California, but I no longer do because it just got so busy that I just was not. It was just impossible to be able to manage that kind of population in Northern and Southern California. I had over 60 patients I think at one point, which was just impossible to do. But now it's more doable, and it's way better because then I have better handle per se on management, and I'm taking care of their discharges because a little bit of what I do is not only do I manage them while they're in the hospital in their stay, but I also handle everything from discharges and authorizations when they need to discharge to home health agency or need any type of durable medical equipment. I authorize those. And so I also provide the authorization. And also sometimes they go to skilled nursing facilities for rehabilitation based on what they came in for and what they had surgery, or if they had any type of care that they needed that they came in for that need rehab after the fact, then I will authorize that as well. Also, acute rehab. Acute rehab is actually one of those stays that I manage as well, along with the inpatient side, because they're technically both acute. It's just different levels of acuity. And so I manage that as well. But once they go to a skilled nursing facility, then I don't manage those patients. And the skilled nursing facility case managers usually manage those patients at the skilled nursing facilities. So at this point, I basically make sure that when they're inpatient, they are qualified to be inpatient. And based on that, I usually use guidelines to determine whether they are able to meet criteria for inpatient stay, or if it's observation, then a lot of times they can be under observation for 48 hours. Most of the time they get treated, whatever the issue is, and then they end up going home. And a lot of times I think people don't understand that when they go to the hospital, it's not always great to have a long stay unless you absolutely need to. Of course, there are some scenarios where the patients are really sick and they really need to be there for a long period of time. But necessarily for a lot of patients, they don't want to leave the hospital once they go to the hospital. And it's not always a great thing because you have to remember there's a lot of different types of people that are sick in the hospitals. So when you're already coming in with some sort of, immunocompromise, like your system is, your immune system is pretty low. Imagine having all of that around you. That's not always a great thing. So a lot of people don't realize this because just knowledge, right? And it's just the education that a lot of people don't remember. We are so busy in the hospitals, whether it's you're in the hospital dealing with the case manager or you're trying to anything that we're doing. Everything is super fast in the hospitals, right? People come, people go. And so a lot of times the education part, even if they're giving it to you, many times either people are just too sick to, pay attention to it, or whatever the case may be. A lot of times it's for me, it's just you have to repeat it a few times of why it's not good for them to be there, and just the education, right? Just continuous education always helps. And so that's basically what I do is I communicate with the case managers at the hospital, making sure that the patients are needing to be there, because trust me when I tell you, a lot of hospitals, you'll be surprised, they keep patients. If you're not following up, they'll just keep you there. A lot of times they're not really in a hurry to discharge, which is mind boggling to me, because every day, most people might not know, but when you're in the hospital, and there's so much that goes into that. And, I can always go into more detail, but a lot of people don't realize that when you're in the hospital, every day that you're in the hospital, it costs money to be there, because you have to pay the staff, you have to pay, all these for all these different tests, and all of that is a cost. I don't know if you've ever noticed, but usually when you're in the hospital, they take these little ticket things, and they're almost they have your information on there, and they'll stick it on to certain things that they pick up, whether it's equipment or you know things that they use for you, right? So all of that is for billing purposes. So a lot of times, people don't realize it's unbelievable how much things cost, and it's people don't know unless you're in it. You don't have a clue about any of this, and so I think for me, that's why I'm trying to really speak to that and bring awareness to people on this is why our healthcare is through the roof, and this is why our everything costs so much these days, right? It's because number one biggest thing is that we're not really utilizing our resources appropriately. I think that's the biggest thing, that I keep seeing over and over. And so I think that you know just being good stewards of why keeping the patients appropriately and making sure that they need to be there. And so I basically make sure that all of that happens for our patients. So that's kind of what I do. And if I need to have a conversation with the families, or if they're not sure about something or some explanation needs to happen, I absolutely take care of that as well. I will contact the families and speak to them and educate them, and letting them know next steps, whatever the case may be. So most of the time, families do communicate with the hospital case managers a lot more than they do with me. But sometimes it does happen where I get involved as well, because sometimes patients will appeal. They don't agree with the discharge that the physician put in, which is normal. It happens a lot that either it's families or patients think that what, they're being discharged too prematurely, or they're still not feeling well. I think the difference is they're not understanding that a lot of things these days can be taken care of even in the home. But for some patients, they're just like, well, I'm not feeling well, so I can just stay here in the hospital. What they don't realize and have to understand is that a lot of times acute care in a hospital, which that's what it means when you're in the hospital, it means that you absolutely need to be in a hospital setting in order for you to be able to get that stay, right? For you to be able to stay in a hospital and be in an acute setting, you absolutely need that level of care. So but a lot of times, they won't agree, and they'll appeal through the appeal process. There's obviously Medicare has an appeal process, and so it goes through the appeal process. And most of the time, I find out after the fact, only because I'm on the health plan side, so I don't really send in that information. It's usually the case managers at the hospital that will send in that information, and so I have to wait until there's results on that for me to be able to find out if the patient, it was in their favor, or if it was, in obviously physician's favor of discharging the patient. So we kind of find that out after the fact. But that's a little bit of what I do. And also if there is denials needed, for example, if and many times we have this where patients refuse to leave. And so when there's a discharge order and patient refuses to leave, we have to assign a denial letter. Or if the hospital is just keeping a patient without really having, the need or the actual acuity that the patient has to have in order for them to be able to stay in the hospital. So a lot of times those denials, I also draw and send to the hospitals as well, and that's one of the things. And I also have um, rounds with our physicians where anybody above 10 days that's been in the hospital, we have to have conversations with our physicians and making sure that everybody's on the same page and the patient is being treated appropriately. And if there is any need for our physicians to have conversations with the hospital physicians and finding out how we can assist and what our next steps are, we also do that as well. I think they do a great job as far as Alignment Healthcare is. They're very proactive in their patients' care, which I absolutely love. That I think that there is not enough health plans that do this, and I think that I've been lucky enough to work for them to kind of see those differences as to some other health plans in comparison to Alignment Health. They're very involved. We also have a program that's a Care Anywhere program, which is basically nurse practitioners and some of our physicians also being in that program. It's a lot of more education. It's a lot more hands-on care, and they basically provide and see patients in the homes, and they also see patients in skilled nursing facilities once they're discharged, just to have some continuity and making sure that patient is doing what they're supposed to be doing and they're not missing anything, and they're understanding what they need to do for themselves. So that's also a program that we have, which is an amazing program. And on Wednesdays usually is when I have, if my patients are involved they're in that program and they are over a certain days that they've been in the hospital, I'll usually talk about them. And we kind of, figure out where we need to be and kind of create a plan of, what our next steps are as well to try to assist the patient and making sure that they have everything that they need. And then what else is there that I do? I also, if I need to do a letter of agreement, sometimes there are facilities that we don't have contracts with. And so since we do have, we also have patients that are PPO or HMO. And, amazingly enough, yes, there are also senior, health plans that provide that. They provide a PPO or HMO. And I'll go into a little bit more in detail about all this and the differences just for education purposes. But yeah, so sometimes I have to do a letter of agreement with certain facilities that the patients want to go to. And so I also handle that as well. So it's just basically I try to manage the patient's care as smoothly as possible, making sure things go smoothly for the patients, and they're already sick and they're already in the hospital, and the last thing they need is more run around and just more things for them to worry about. So I try to make it as streamlined as possible and try to make things easier for them as well. I also work for a hospital on the weekends as a per diem nurse. I work for Cedar-Sinai Medical Center in Beverly Hills, and I manage 6 teams most of the time. We obviously have teams divided into case managers, and so we have different programs as well. Sometimes I cover those programs if a patient gets admitted and we think that we can manage the care in the homes. We have a 360 program that's amazing. It's actually we provide everything pretty much for the patient to be cared for in their own home, which is great because you don't want patients to be, especially like I said, right, immunocompromised. And, if we can take care of you in the home, you're used to your own home environment and your, the the bacteria that's around you, right? So you're used to all of those things. So you're not going to get sick. But in the hospital, you have all these other things that you're exposed to. So of course, we're trying to prevent, more issues and more um, bacteria, whatever the case may be, right? Viruses, whatever other people have, right? That you can get. So we try to prevent all of that, and it's been an amazing program. So we do that as well. And I would have to say, probably working with so many different hospitals as I do, and working for Cedars-Sinai Medical Center, I would have to say Cedars-Sinai Medical Center has to take. I mean, they're number one. I think they are number one in California and number two in the nation, if I'm not mistaken. But um, I think that they definitely are deserving of that, and I think that they do everything amazingly as far as discharges are concerned. If patients are in need of, obviously we find out if the patients are in need of their low income and they're in need of transportation, we will provide that. And so there's just so many little things that they do that's so amazing. And we are an amazing team. Imagine having 6 teams on the weekends. Usually it's about 60 patients, and I'm one of the case managers on the weekends. We have 4, which is great because it could get pretty hectic. And so there we handle all of the discharges, making sure that when patients are leaving, they have everything that they need, whether it's home health or whether it's IV antibiotics, whether it's a durable medical equipment, whether it's supplies that they need for, as far as, some people have, uh, gosh, what am I thinking of right now? Wounds, for example, right? So they need wound care supplies. And so that's pretty much what we will order, making sure. And we work with, here, obviously, it's the hospital. So I work with now a lot of health plans or medical groups, and I'll go into detail about that as well and give you guys more insight and education on that as well. But I work with them closely to make sure that authorizations are provided and making sure that they can go home with all the equipment, or if it's already been delivered to their house as well. Sometimes they're needing oxygen, for example. We need one for the hospital and for them to have that at home as well. So it's a lot of different moving parts to discharge. So just to make sure that patient has everything that they need before they go home. So, but I also do appeals. So, the same thing, right? So now I'm on the hospital side. So when a patient decides to appeal, I will send the information over to Levanta, which is basically the Medicare provider that reviews the all this information, and then will make a determination, and they notify us of the determination. Or we can also we have access to Medicare's or Levanta site that we can go in as well and check on that as well to see what the outcome was. So but yeah, that's a little bit of what we do on the, it's mainly just discharges. And if we have, we have to speak to families as well. We do a lot more of that on the hospital side, obviously, because a lot of families have questions about, co-payments, and we don't always have those answers, as far as case managers, because we don't know what their benefits are a lot of times. And so we rely on our vendors to be able to provide that, because a lot of the vendors are the ones that will pull their benefits and find out exactly what they owe and what their co-payments are. And so we always let them know. But, families have questions, and I love that they actually have questions and they want to know and they're involved. It's very rare that you see that. And when you do, I'm so grateful for that. When they do have questions, I get happy about it, because I'm Oh my gosh, people actually care and they want to know, because a lot of times you see that people just don't care. You know what I mean? So it's just a lot of these different things that you see, and you just get very excited that people actually care and they want to know and they want to care for their loved ones. But we pretty much assist with everything in the hospital. If it's if it's any type of um, hospice agencies that they want to speak to, or and again, I'll go over all of this in more detail on what everything is and how what they all do and all of their roles. I know it's a lot of information, a lot of times given, and when you're overwhelmed and your loved one's in the hospital and you get all of this information, it's like information overload, right? For a lot of people, I mean, it's understandable, and you're trying to deal with all of the stressors, right? And the stress of your loved one being, sick. And then on top of that, now you have all this information being basically offloaded on you. So it's just a lot to take on for sure. So I will definitely break this down, eventually down the road of all the different things. And obviously, you can always email us as well if there's any type of questions. I'm sure the links are all there for you if you have any type of questions that I'm not addressing, for example. And you can, or if you wanted to find out a little bit more in detail, we could definitely help out as well. So those are some of the things that I do in the hospital setting and also on the health plan side. And trust me, it's not something that you're going to learn overnight. It's a lot. I mean, I've been doing this for many, many years, and I still, I mean, I know it now, so well, but there's just so much and things change so frequently. But that's kind of in a nutshell of what I do. And the reason why I'm still in it is because I love to be involved and help out as much as I can until I'm no longer able to with time and obviously whatever other things I have going on. But I love to be in it because I get to find out all the new updates for my patients and what's going on. So I love that aspect of it. But I wanted to touch base a little bit on what else I'm doing, right? On top of obviously my jobs. A few years ago, I actually started in real estate. So I ended up getting my real estate license in California. And so I really decided to go in this route because I wanted to help out the senior community. And so, because of all of these things that I do and the involvement I have in the discharging and finding out, even just from a case management perspective, when I was even case managing patients, I realized that patients didn't know what options they had, and so housing was one of the biggest things that they were needing assistance, and they didn't know what to do. And obviously, I was working very closely with a lot of our social workers, and I love my social workers. Trust me, they're a lifesaver when it comes to more of the social components of people's lives, and so they're a lot more knowledgeable than I am in that sense. And we literally partner up. We are partners in this, and so we work side by side. A lot of clinical side of things, obviously, nurse case managers address, and then on the social side, it's more of the social workers that address those things, which is great because we cover pretty much the whole entire patient, right, from a clinical and a social perspective. So I think that I really got into that because of this, because I decided to um, solve this problem of them understanding that they had more options than they thought, and just educating them. And I ended up getting into and just learning so much about housing and real estate. So I started. Kind of understanding and learning and working a little bit in multifamily and in fix and flips and in opportunities in investments, right? Even some seniors that have money that want to invest and, basically down the road have more money. And so it was just a lot of different things. And it was just so much great information. And so I decided that, what, this is the way to do it. This is, if I can if I can provide housing and I can help them, whether it's, selling their home and them trusting me and, that I had their best interest. And I actually even published a book and explaining all of this. And, there's copies of the book as well. So if anyone's interested, it's on my website. You can download it. It's an amazing book. It's got a lot of great information. So that's kind of how I got into real estate. And so I did some fix and flips. I am in Memphis, Tennessee right now, and planning on obviously going into more states and having more opportunity. Really focusing on this population, on the senior population, and really helping them with medical and housing. So, but that's kind of where I'm at as far as real estate is concerned. And I'm also working on opening up a nonprofit, and that should be coming hopefully next year. And we will be basically helping out our senior community with, like I said, everything medical and social as well. So it's going to be something that I'm very, very proud of. And I am just super excited to help as much as I can, educate as much as I can. And that's really the goal ultimately, for me to be able to impact in a bigger way and really provide some assistance and help to this population. I think there's just so much that we can do to plan ahead. I feel like a lot of families don't know what to do and how to plan and what do you need to have in place. There's so much out there that you need to know that I think people just don't have a clue. Unless you're in this, it's really hard to know. And so I think that's really my goal, to try to provide as much education and as much assistance as I can to make life easier for a lot of seniors now or their families who are about to be. Even when you're planning, I think it's great to get ahead of this, right, and to make sure that you have everything in place. But so more to come on that, and I am. Thank you for joining me. And furthermore, I am looking forward to seeing you guys next time on the next episode. Thanks so much.
The most fun way to watch us is on YouTube, so be sure to like and subscribe. Also, you can follow me on Instagram, Facebook, LinkedIn, and listen on Apple and Spotify as well. If you would like to learn more about a specific topic, please reach out to us by email. You can find all this information below in the show notes.